All right, so we're going to do what's called cupping now, or myofascial decompression. This has been very popular in the last several years. It's a treatment that has been around for thousands of years, but it's been very popular, especially since the 2016 Olympics, when people saw Michael Phelps with these little bruises, circular bruises around his shoulder. And so people are like, what is that? And you know, most physical therapists and athletic trainers and physical medicine professionals are like, oh, it's cupping. We've been doing that for a long time. So what we have here is an assortment of sizes of cups, and we go from very small to the largest cup, which is about 2 inches in diameter. So again, you're not going to just bigger is not always better. You want to choose one that is the correct size and for what you're trying to get. You can do multiple, especially for quad muscle. You can do multiple spots along this. There's two different ways. You can find the spot that is like, for example, we've been working right about here for this patient. So we can find a spot and we put a cup over that spot that is the right size, or we could do multiple cups over trigger points in the leg. And if you recall back to when we were talking about trigger point massage, that this is, you're helping reduce nerve pain because of that. So what we're gonna do now is show you how to apply the cups and what it looks like. So we're gonna take the cup, we've put a little bit of lotion because if there's more oil or lotion on the leg, again, that gives a better seal for this vacuum. What you're doing is you're pulling a vacuum inside of this plastic or glass tube. This one's plastic, certain ones are glass. We will be using a pneumatic tube. What we do is you put this, and now I'm just pulling air out. And because of that, I'm pulling the skin up because there's a vacuum in here. There's low pressure, so it's pulling the skin up. Now you can already see that there's a little bit of discoloration there, right? That's supposed to happen. Now, sometimes this can cause significant bruising, and that's fine. It's not a bad bruise. It's pretty superficial. So we're gonna leave this on here for 5 to 10 minutes, sometimes 5 to 8 minutes. And this is what's known as static cupping. Static cupping means it's not moving. So find one spot, it's just gonna stay there. And the idea is that what you're doing is you're taking those levels, those layers of tissue, and you're pulling them and stretching them apart. So if you have nerves that are compressed, or you have tissue that hasn't been moving that well, you use this decompression to help loosen things up. And this is just static cupping. So, all right, so we're gonna do something called slide cupping. Slide cupping is where I pull a slight vacuum, not a full vacuum like I had before, it was much higher before. Still enough that I'm still separating those tissues and decompressing them. But like it says, I'm gonna slide. So I'm gonna find a spot, I'm gonna go up and down the leg here and slide back and forth. So now I'm getting a little bit of that friction massage that we were talking about before, where you are getting the tissue to kind of like, you're causing friction and increasing blood flow, but I'm going back and forth. This is really helpful for those like quad and low back and hamstring issues that are like, that can get so bogged down with tightness and tenderness. So we can use this. Again, probably do about 30 or so strokes. Takes you about, up and down's one stroke, takes you about a minute or two. And then all we do is just release the pressure. And again, we can see there's more blood flows. Again, a redness here that we're looking for. We're not trying to cause these bruising and bleeding and all these issues, but this is a pretty standard way to do cupping.